안녕하세요. 동타왕고입니다. 와, 진짜 운동하기 너무 싫습니다. 너무 졸려요. 빈둥빈둥 거리다가 결국에 진짜 영상을 틀었습니다. 아, 진짜 이렇게 영상을 찍으니까 진짜 하게 됩니다. 어쩔 수 없이 이렇게 조금씩이라도 하니까 진짜 약간 의지가 없다. 나는 의지가 없다는 시는 분들은 이렇게 영상 찍어서 유튜브 한다고 주변 사람한테 떠벌리고 다니세요. 아, 오늘도 증시가 폭락했습니다. 어저께 미국 증시가. 유럽은 뭐 계속 폭락하고 있고요. 이탈리아 확진자가 3만 명 넘었다 그랬나? 그다음에 사망자가 2,500명. 독일 확진자가 현재 우리나라보다 넘었고요. 9,000명 정도. 프랑스랑 영국도 이제 기하급 수적으로 늘어날 건데, 기하급 수적으로 늘어나고 나서 한 2, 3주가 결정이 되지 않을까. 그럼 4월 초 그때가 이제 진정한 매수 타이밍인 것 같은데, 일단은 오늘 주식도 봐야겠죠. 오늘은 수요일, 목요일. 오늘 목요일이네. 오늘 상체 운동하는 날이네요. 음. 그럼 오늘 일단은 어떻게 하지? 오늘 일단은 스트레칭하고 이거 푸시업 바 하겠습니다. 내일 저쪽에서 턱걸이 해야겠네요. 오늘도 쉬어요.
For the rafting trip, we considered coronavirus an inconvenience.
My biggest worry was getting sick before the trip.
Now they're worried about Mason's mom, who has pre-existing lung problems. As the group returned to cell service, their phones lit up.
That's when I got a text from my mom saying, "You need to call me immediately. The world's going crazy. Don't touch anybody."
Mason, who goes by the river rafting nickname One Chain, related to a comment posted to this New York Times story about their return. Is anyone else thinking about Charlton Heston and the Planet of the Apes? Even coronavirus isn't quite this apocalyptic. Actor Jared Leto is having a similar back to civilization moment. He tweeted, "Wow, 12 days ago I began a silent meditation in the desert. Walked out into a very different world. Mind-blowing." You washing your hands a lot? They already were to avoid spreading germs while camping. Don't touch your face.
Oh, you saw that? Oh no.
Kate said as their trip ended,
I was excited to go home and hug all my best friends.
at least she's still hugging Mason. Compared to a rapidly changing world of masks and sanitizers, rapids and ignorance, bliss. Ginimo, CNN, New York.
And thank you all so much for joining us. Don't forget, you can watch Out Front anytime. You just have to go to CNN Go. AC360 with Anderson begins right now.
Good evening. Thanks for joining us. We hope tonight's broadcast helps you and your family stay safe and informed. Today, life in America continues to cross into the new abnormal. Nationwide confirmed cases of coronavirus grew
와,
to
미국도 8,000명 넘었네요.
6 a.m. this morning. They now
사망
have
145명.
8,500, with nearly 3,000 cases in New York State alone.
사망이 145명이니까
At least 125
검사를 이제
people in
시작했으니까
America now died of the virus.
우리나라의 2배죠.
President Trump invoked emergency wartime
만
authority
2만
to
명,
speed
확진자
production
2만 명
of
넘게 나왔다고
equipment
보면
and
되겠네요.
ventilators, both of which are in short supply. And adding to the concern about overwhelming the healthcare system, a member of the president's task force, Dr. Deborah Birx, warning of reports out of France and Italy that more young people are becoming seriously ill from the virus. She said that younger patients may have seen the cases in China and South Korea and gotten a misleading impression that this was disease mainly of the elderly and people with pre-existing conditions. We'll talk more about that in just a moment. This video is from Italy, and it gives you a look at how dire things are there. We'll talk about this video with Dr. Sanjay Gupta coming up and what Italy may teach us about what may happen here. On the economic front, more impact on tens of thousands of good-paying jobs. Detroit's big three automakers announcing a temporary production shutdown. And starting Monday, the trading floors of the New York Stock Exchange will be shut down, with all transactions taking place electronically. The Dow Industrials, by the way, shed another 1,300 plus points today. And CNN learned that the Federal Reserve is planning for a crisis that could last 18 months and a year and a half.
와.
We'll talk about that, what that may look like tonight. Senate Minority Leader Chuck Schumer joins us as well to talk about the relief bill that just passed today and another larger bill now under discussion. We'll also pause for a moment to reconnect, if we can, with the reason why this all matters. Because in what's become a daily blizzard of warnings and life-changing announcements and numbers, rising case counts, it's very easy to lose touch with that. So tonight, and as long as we can, we'll try to bring you the stories of those who have lost their lives with this virus. This evening, a man in Florida, according to local reports, who was married for 56 years. His name, Richard Curran. He has died. Also, retired New York City firefighter and fire marshal John Knox, who'd already lost some of the use of his lungs from working at Ground Zero. We're going to tell you his story tonight. And in a way, as of this moment, New York is a kind of ground zero again. CNN's Erica Hill joins us now from Times Square. So, Erica, the trading floor of the New York Stock Exchange is going to be closing on Monday. I mean, that's almost unheard of.
It's historic, to put it mildly, and it's important to point out, as you did at the top, Anderson, that while the trading floor will be closed, electronic trading will continue. We haven't seen it shut down, yes, during World War II, yes, after 9/11, but this is really a big moment. The reason that the floor itself is being closed is because 2 employees tested positive this week. Our own colleague, Allison Cossack, telling us Monday morning when she showed up at the exchange, where she's been for years at this point, she says everybody knows her by name. For the first time, they started taking their temperature. And they checked your temperature as you were going in, and the exchange is telling us that some of those tests, when there were issues, they sent them for further testing, and 2 employees, again, had tested positive.
I view it as in a sense, a wartime president. I mean, that's what we're fighting.
The president and I agree this is a war, and we're in the same trench.
As New York announces at least 2,300 confirmed cases, the most in the nation, and a jump of 1,000 in just one day, Governor Cuomo taking new measures to combat the spread.
And I'm asking all businesses to work from home, but today we are announcing a mandatory statewide requirement that no business can have more than 50% of their workforce report to work outside of their home.
The executive order exempts essential services, including first responders, healthcare workers, pharmacies, and food delivery. About 20% of the New York cases require hospitalization, making the need for additional beds increasingly urgent. President Trump responding today.
We're sending, upon request, the 2 hospital ships. They're being prepared right now.
The Navy ships will be sent to New York and the West Coast. Multiple states also putting out an urgent call for nurses, as the virus is now confirmed in all 50 states.
It's the invisible enemy.
Meantime, life continues to change. The border with Canada closed to all non-essential travel. Across Northern California, nearly 8 million Americans now told to shelter in place. And in Kansas, children will be home for the remainder of the school year.
Unprecedented circumstances threaten the safety of our students and the professionals who work with them every day, and we must respond accordingly.
More confirmed cases across the sports world. The Ottawa Senators, the first in the NHL to announce a player has tested positive. The entire team asked to isolate. Meantime, pressure growing to cancel or postpone the Summer Olympic Games in Tokyo. In Florida, defiant beachgoers causing alarm around the country, while officials stress this is only the beginning.
As I hear people say certain age groups are immune, I know this. In Michigan, we have a 5-year-old that is tested positive for coronavirus. This is a situation that impacts everyone in every age group, and I implore people to take this seriously.
Erica, you're in Times Square. Have you noticed any changes there? I mean, are there? I was surprised earlier today when I was driving through New York how many people were out and about compared to I was in Washington, D.C. this morning. Have you noticed what's Times Square like right now?
I think there are fewer people out in Times Square than maybe in some of the neighborhoods. Anderson, there is a marked difference from when we talked to you from this same spot on Monday night, and that's because Broadway is dark, stores are closed, restaurants and bars are closed, and it really feels very empty, and it's a feeling I've never felt in Times Square before.
All right, Erica Hill, thanks very much. We just learned that the first sitting member of Congress has tested positive, Florida Congressman Mario Diaz-Balart. He says in a statement he's feeling much better, but urged people to take the virus, quote, extremely seriously. Meantime, the Senate passed phase 2 of coronavirus relief efforts, including paid emergency leave with a number of restrictions on who can get it. Lawmakers are now working on a phase 3, a massive stimulus package. Joining us now, Senate Minority Leader and New Yorker Chuck Schumer. Senator Schumer, thanks for being with us. Just in layman's terms, can you just talk about the tangible effects Americans might expect to see from this bill as passed?
Yes, there are a number of things. First, we need to have a Marshall Plan for our hospitals. As the number of illnesses increase, the number of people seriously ill increase, our hospitals are not totally prepared. They need more beds. They need more ventilators. They need more equipment. They need more personnel. Some hospitals even report now that they've finally gotten the tests. They don't have the swabs, the nasal swabs, to implement the tests. So we need a Marshall Plan immediately. And the ventilators, you know, a few weeks ago, some of us were talking about the testing problem, and we fell behind. 2 weeks from now, the problem of a lack of respirators, a lack of beds, will be just as crucial. So we need that. We need a second thing. We need what we call employment insurance. If you, right now, unemployment insurance is hard to get. You get paid only a fraction of what you'd have at work, and many people are not covered. We want to say anyone who loses his or her job because of this crisis will get paid fully by the federal government. It's employment insurance, not unemployment insurance, and that will put money in the pockets of the people who need it most. Third, we need to improve on the bill we passed today for both paid sick leave and paid family leave. We need it to be extensive, we need it to cover almost everybody, and we need the federal government to step in so businesses aren't hurt, especially small businesses, when they're not having any income. And finally, we need to make sure that everybody who has this illness gets treatment for free, basically. If people have it and the beginning signs of it, and they don't show up and they just walk around and spread the disease because they're afraid it'll cost them $200, $300, $400 through a copay or a deductible, we have to stop that. So those are some of the things that we in the Senate, we Democrats are pushing for, and I think Anderson, we can come to a bipartisan agreement. I spoke to Secretary Mnuchin tonight. I know some of the things they're interested in, some of the things we're interested in. A lot of them overlap, and there are some things we're going to want. The one thing I did tell him as well, though, if there are going to be some of these corporate bailouts, we need to make sure workers and labor come first, that people are not laid off, that people's salaries are not cut. If these big companies, many of which did buybacks, the airlines, I think, did about $300 billion of stock buybacks, they have to put their workers first if they're going to get this help.
You talk about a Marshall Plan for, for the hospitals. Obviously, the hospitals here are the front line. We don't want medical professionals, the nurses, the doctors getting sick. They're going to be working around the clock. They already are. That's over a long term, then this may be a long term. That's part of the thing. How likely is it, do you think, that whether the National Guard or the military is going to be needed, or the Army Corps of Engineers is going to be needed to start building field hospitals? I mean, taking over convention centers, schools, facilities, whatever it may be.
Yesterday, we asked for the president to use something left over from the Korean War, the 1950s, called the Defense Production Act, which allows us to use the military to both create things and build things like hospital beds and temporary facilities. We've seen how those were built in other countries. It also allows a mobilization of manufacturing and allows the federal government to tell manufacturers, we need more masks, we need more swabs, we need more ventilators. But there are so many different aspects to this, Anderson. Take many large cities, New York City. How do the workers get to work? Right now by the subways. But if the subways aren't used anymore, how are they going to get there? And yet the subways are a place where people come in close contact. So this is a massive problem. It takes bold, strong, immediate action. And we'll have to stay at this for a while because there are so many different problems we have to deal with. But we can't be partisan. We can't be timid. It's got to be bold and strong and comprehensive. And we're prepared to stay here and do that.
How much of the decisions in New York are made by the governor or by the mayor of New York City? How much is it a federal response? Obviously, it's got to be everybody working together.
Well, it is, and we have good coordination with the state and the city. The federal government's job is mainly to provide the resources. Even a city as large as New York, a state as large as New York, can't do it on its own. They have good leadership there, but we need to make sure that the money for the people, for the unemployed, for the hospitals, comes from the federal government. We're the only place that can do that. And in states not as wealthy as New York, all the more reason.
You know, certainly 9/11, especially in the terrible days that right after 9/11, there was an extraordinary spirit, not only in the country, but in New York City. It was a privilege to be in New York at that time, to stay with the city and to watch the people come together. Citizenship now seems to be more important than it has been for a long time in our lives. Can you just talk to people about what that means, whether it's New York or somewhere else, to be a good citizen right now?
Yeah, I have lived through 9/11. I lost 3 people, 3 friends that I knew in the towers. I was there through the crash of 2008. But this is the worst of all for a variety of reasons. First, we're very uncertain as to what is going to happen. There was some uncertainty after 9/11 in the days after we were worried we might be attacked again. But it's not the same as this. How long is this going to last? Who does it affect? We're not even certain, you know, what is who it affects. We're just learning now that children can be affected by the illness. So there's that. And then there's isolation. What New Yorkers and Americans like to do is come together as we did after 9/11 in times of crisis. But here you can't. You're not supposed to be near other people because obviously it spreads the disease. And I urge people to make sure they keep their distance. But so it's much harder. Having said that, I believe in the spirit of New Yorkers. I've talked to a lot of people on the telephone today, and people are willing to do what it takes and overcome this virus and once again bounce back. After 9/11, a lot of people said New York would never bounce back, and we came back bigger and stronger.
Yeah, well, we're all in this together, more than now than ever
sure
before.
are.
Senator Schumer, thank you. I want to get perspective now from CNN's chief medical correspondent, Dr. Sanjay Gupta, as well as someone who's having already to make some very tough decisions, Dr. Peter Slavin, president of Massachusetts General Hospital in Boston. Dr. Slavin, let me start with you. The situation tonight, in your view, the medical situation for the doctors, for the nurses, the patients, what is the situation in Boston? There's been a huge cluster of cases nationally. I mean, you heard Senator Schumer a moment ago saying we need a Marshall Plan for hospitals. How bad is it? What do we need to make it better?
Well, clearly the situation is heating up here in Boston. A week ago, we had no cases in any of our hospitals across our health system, Mass General, Brigham, and tonight we have 13 patients with cleared disease and another 150 who were suspicious of the disease who are in the process of testing. So the numbers are going up dramatically. We are concerned about where this is ultimately going to head. We certainly can expand our capacity dramatically. If this gets as bad as it was in certain parts of Italy, this will be an overwhelming problem. We've been preparing for things like this for years. We've been preparing for this particular disaster for a couple of months, and we're as ready as we can be, and our staff is energized to try to do their best to take the best care possible of our patients.
And Dr. Slavin, can you say, how many ICU beds they have? Do you have enough beds? Do you have enough ventilators? It's hard to model out. It's hard to project what this may mean. We don't know, because the testing problem, we don't know how many people have it or even have been able to do tracing on all the people who may have it.
At Mass General, we have over 100 ICU beds, and we have come up with a plan to potentially double that number, and we think we have the space in our operating rooms, recovery rooms, and we have the ventilators to be able to accommodate that. We also have been setting up outpatient spaces for patients with acute respiratory illness to be seen and treated and tested. Unfortunately, in Boston, the testing capacity is ramping up very dramatically.
Sanjay, there's a study from the journal Pediatrics that says while children in China infected with coronavirus showed less severe symptoms than adults, infants and toddlers were vulnerable to moderate and severe infection. Do you have any sense of why that could be, what that might mean here, or what, obviously that's an extraordinarily different focus than we have been hearing so far.
Yeah, I mean, I think what we've been hearing, what the narrative has sort of been is that, kids are basically sort of protected from this because that's what some of the early data has shown. And it is true that they're still far less likely to become infected or seriously sick from this. But I saw the same study, and it was a study of about 2,200 patients, and there was a 14-year-old boy, one child who died. But they found that while adults, about 20% of them will develop serious or critical illness. With kids, it was about 6%, so a lot lower, but not negligible. And as you mentioned, with infants and toddlers, about 11% of infants and toddlers who got the infection became seriously or critically ill. So they're at risk, and I think we need to remember that. One of the other studies, also Anderson showed this, and I think it's really important in the context of all that's been going on, that 4 out of 5 people who were confirmed to have the coronavirus contracted it from someone who didn't know they had it. 4 in 5 people who got it from someone who didn't know they had it. We all have to behave like we have the virus. That's the whole point, I think, we're learning from these studies.
Let me repeat that. We all have to behave as if we have the virus. Can you just explain that?
People keep asking, so how are we supposed to conduct our lives? What are we supposed to do differently? And we give all these sort of recommendations about washing hands, wiping surfaces, and all that, and those are all good recommendations. But I was thinking to myself over the last week, Anderson, how best to convey how to live your life. And I don't want this to be, again, alarmist. I think you and I are both intent on not alarming people, but if you believe that you might have the virus, it could be something through your hands, it could be something you're carrying in some way, how would you not infect someone around you? What would you do to try and best reduce the chance of that happening? Wiping surfaces, making sure your hands are clean, obvious if you have any symptoms at all, isolating yourself, all those things. I mean, you just have to behave like you have it. It'll change how you interact with people and how you interact with your environment.
Dr. Slavin, can you just explain for people who should and shouldn't be showing up at a hospital right now trying to get a test? I had a doctor offer me a test because I had a slight cough. I don't have a fever, so I said no, because I think only tests should go for people who really show signs and symptoms.
I think the only people who should be coming to hospitals are those who may need to be hospitalized, people with high fevers, people who are developing early signs of breathing difficulty, people who have more mild symptoms should stay at home. They should be in touch with their doctor, and there's really no reason at this point to test them. We need to direct the limited number of tests to people who need to be admitted to hospitals, so we know how best to care for them and cohort them. And we also need to test for healthcare workers and other first responders so that they're not making a bad situation even worse.
Yeah.
And we need to employ technologies like telemedicine so that we can continue to provide care to patients, particularly vulnerable patients, from home. Telemedicine can clearly continue care for those individuals and do it in a way that doesn't expose them to being around other people.
Yeah, Dr. Slavin, thank you so much for what you and all your nurses and doctors and technicians and everybody are doing. Thank you for helping save people. We appreciate it. Dr. J, we'll come back to you shortly. Coming up next, New York Mayor Bill de Blasio, whether New Yorkers will be asked to shelter in place and what the next steps are here, what needs to happen here and in the city where you may live. We'll be right back.
Very spectacular jumping. Beautiful shape over the fence. And it's a great clear. 2 years in a row, Dan Mayer is the champion of champions.
That is world-class show jumping. You'd never see anything better than that.
The straight talk you need from your man in Washington, who won't back down. With Jake Tapper, Tuesday through Saturday on CNN. He made history in Japan as the first black man to captain his team to victory at the 2019 Rugby World Cup. South Africa Springboks captain Sia Bilisi. This month on Talk Asia, we look back at his path to triumph in Yokohama.
Obviously, me not giving up and training is harder than quit.
와, 저 오랜만에 운동 제대로 하는 것 같은데.
So today's kind of a day to understand all the things that are going on in the world
where people don't have freedom.
Welcome to CNN's fourth annual My Freedom Day to be part of this global effort to change the world.
A resounding yes to freedom.
It's everything. You united to speak out against modern-day slavery.
A lot of the different products that you're buying are made with human trafficking, and you're not really aware of it.
Thank you for raising your voice.
Settled on Japan's eastern coast, Ishinomaki is a place deeply connected to the ocean. Its seafood is a flavorful point of pride. When fishing is your life, the morning means one thing: work. Chef Masateru Imamura is bracing the cold winter winds to taste seaweed at its peak season.
A little salty, isn't it? This is the first pig which we pick first after throwing the net.
The sky is beautiful today and fishermen are working very busily. Seaweed is quite familiar among Japanese people and used for rice balls or sushi. It's cropped from sea like this and dried to be processed later. Mr. Aizawa, you told me this is the peak season for seaweed. Can you tell me the reason you leave port before sunrise?
Well, if we work to crop during the daytime, it may affect the
오늘은 여기까지만 하겠습니다.
quality wise. It's better to crop in the
힘들어.
morning than in the daytime for quality and fresh.